Good evening, everyone, and welcome to the Budget 101 series. This is our part 5. We have a lot to cover today. You have the options to watch on Metro, and you can also Metro TV, or you can watch online on Facebook. For those of you that have questions, if you haven't sent them yet, you can still send them to buckley.allen@nashville.gov. And in the past, we've had audience members that have questions. And so if you do have questions, there will be papers and pen in the back. You're welcome to write your questions and send it forward. We want to make sure that we are covering everything. I'm going to start just like Chair Allen always does. She's not able to join us today, but she goes through why we're doing this and a couple of slides. And basically what we want to do is we want to educate and to provide information to our constituents about the budget process. We also want to make sure that we give them the opportunity to see how Metro budget works by inviting different departments to present to us and to take questions. So the first slide is on where does Metro money comes from. We were able to look at this in part 1 of our series. As you can see, property taxes is the biggest one. This slide is also on the website. So we talk about this in part 1. And then since then, we started looking at where does the money goes? Where does Metro spend all the money that we collect on our budget? So the first session that we did, as you can see, was education, which was 38% of our budget. Then we look at public safety, which is 20% of the budget. And today we're looking at health services. We want to look at infrastructure and transportation. We're also going to talk about parks and housing. Those are the ones that we're looking at. And then next week, we will be looking at debt service. So by the time we're done, we should have covered, I'll say 98% of where the money is being spent in Metro. So the series started in December, again with 1 and 2, looking at where the money comes from. And then in January, we've been taking a look at where the money went, and so where the money is being spent. So this is our calendar for January. Today we're doing NDOT, Parks, Health, and Social Services. And like I said, on January 27th, we will be looking at debt service. And then in February, what we want to do is, so you've seen what the budget looks like. You've seen where the money comes from, where it goes. You've heard from the department. And then in February is where we want to bring the community together. We'll be hosting a bunch of community panels and panel discussion experts talking about different things in the budget. So again, you have the opportunity to watch online on Metro channel. You can join on Facebook. And again, send us any question if you have any. The last slide is where to send your questions, and also to let you know you can watch this session and the past ones on Metro YouTube channel. At this point, we'll get straight right to it. Our first presentation will be from NDOT, and we're glad to have our new Director of Transportation, Ms. Diana Halacon, with us. And so, Ms. Diana, if you want to step up, and if you have your team, feel free to bring them and to introduce them.
Mouse is not working. Sorry, the mouse is not working. I can't get it off the page.
We got it? This is good.
Page. What happened to the mouse?
Is the mouse up there?
Yeah, it's not working.
The mouse is up there.
Supposed to do that.
Get it?
Weird. Let me see if I can get it for you. don't know we went for a ride.
Yes.
Okay, am I on?
Yes, you are.
Good evening. Thank you, Madam Chair, for allowing us to present tonight. Again, my name is Diane.
It's this other one. It's the one on your right.
Thank you. I'm sorry. Thank you for the guidance and the patience. I truly appreciate it. Thank you, Madam Chair, for allowing us this opportunity to come and present our Budget 101 on the Department of Transportation and Multimodal Infrastructure. Again, my name is Diana Alarcon. I am the new director. This is day 8 on the job, so I am adjusting to Nashville, but not to the weather quite yet. I moved here from Tucson, Arizona, and it is quite warm over there, and I'm adjusting. Philip has promised me no more snow. I'm just kidding. But let me introduce who's with me. I have with me my assistant director, Philip Jones, who's responsible and over our operations side. And to my right, I have Brad Fries, who is over our engineering side. And they're going to have be sharing with you exactly what they do as part and their roles and responsibilities. So, do I just hit enter? There we go. So we just want to highlight again our mission. You know, we are a new department, and so our mission statement right now at this time is that Nashville Department of Transportation Multimodal Infrastructure develops and maintains a transportation network that offers choice and connects neighborhoods, residents, and businesses to places they need and want to go in a safe and efficient manner. And we are really already out of the gate and hitting the ground hard to make sure that we're achieving that with such a young department. So our department was actually created in July of last year in 2021, and so we're 7 months into it, and we have big plans of really bringing the department up to speed and growing it so that we can meet the expectations of our mayor, council, and our community. So here's a little bit of what we do. We're responsible for maintaining the right-of-way. We do long-range planning for transportation initiatives. We're responsible for an annual maintenance program of paving and maintaining it. We also are responsible for traffic management, sidewalk, bike lanes, traffic calming, and permitting. And so just a little bit about what all that means is that's roughly about 2,200 miles of public roads and right-of-way that we're maintaining. And more than 835 signalizations, intersections, over 6,000 named public streets, over 300 bridges, 140 miles of bikeways, and 1,700 parking meters and approximately 1,800 parking spaces from the Metro-owned garages. So this is what our org chart currently looks like, and so I am actually going to turn it over to Brad and let him kind of break it down a little bit for you, and then I'm going to turn it over to Philip and let him break it down a little bit about the different areas of responsibility.
Well, good evening. My name is Brad Fries. Like Diana, I'm a little new. I started back in November 1st as the chief engineer of the Nashville DOT, so very excited to be with NDOT. Before being at NDOT, I had 19 years with the Tennessee Department of Transportation, so very, very excited about being with NDOT, and especially at this time when we're at this growing stage, this foundational stage that we're at. So if you look here real quick, you'll see plan, design, and deliver in boxes there. So really, you know, on the engineering side, you know, we do everything from the early planning of a project, working with Metro Planning Department, but also going into the development side as well. So if you see in that plan, you actually see Transportation Development Services on there too. So you're probably no surprise to you that we have a lot of development activity here in Nashville, which is awesome, and awesome for the economy here in Nashville. But we have a high workload here at the Nashville DOT with that office, reviewing those developments, making sure you know, we're looking at traffic studies and traffic impact analysis related to those. So that is what's involved in that office. So we also have the design side, which is really focused on all of the design efforts, be it things associated with general roadway projects, but also thinking in terms of sidewalks and other aspects of that. We have a design section that really focuses in on that. So, and then we have, you see that active transportation box right there. That's really, active transportation is really what we consider our bike and ped program as far as on the design side. Really focused on building those systems and deploying those in a timely manner. So, and then we have over here, you see the delivery side. So that's really following the projects out the door when they get let, making sure we're delivering those projects on schedule. So you see that delivery side and really that project oversight and that delivery side. So one thing that you don't see on here now is we were recently awarded, as of yesterday, a grant from the Tennessee DOT for our traffic management center. So we are actually, on this engineering side, we will have a transportation management section as well under there. So that's where we're going to be building our traffic management center. We are funded through that grant for 3 years. That grant involved funding for staff as well as some of the technology in there. So a TMC, I refer to it as a TMC, a traffic management center, is really going to be the brain, the hub of our traffic management services in real time, making sure that we are operating the system efficiently and doing all we can to maximize the capacity that we do have on the roadway network. So sorry.
No, that was really great. And so I'm going to turn it over to Brad. Excuse me. Thank you, Brad. I'm going to turn it over to Philip. But just real quick, under Philip right now, we show that traffic control center, our traffic management center, as Brad refers to it, under operations. And that's actually being pulled out and will now be rolled under Brad's group, which is infrastructure development and delivery. So now I'm going to turn this over to Philip so he can talk about his operational side on infrastructure. There you go, sir.
All right. Philip Jones. I'm 27 years formerly with the Public Works Department. Pleased to have come into this change of the Nashville Department of Transportation. I consider it a pleasure to be part of this group with Ms. Alicorn and Mr. Freeze. I think we have a very strong team coming into this. I think things really look positive. I'm over the infrastructure operations and asset management side. And those things that cover under operate are the neighborhood and arterial management. That's everything in your right-of-way, from your brush pickup, sidewalk repairs, curb repairs, potholes. You know, it covers any and everything in the right-of-way. That's your alley maintenance. That's kind of under the operate arterial management. We have the special events, which covers our assistance with the NFL, Titan Stadium, helping with the traffic control, arterial management for all that. Under the maintain and maintenance, that's what's covered under our potholes, tree trimming, anything in the right-of-way of the entire county. Regulating and enforce, that's kind of our parking policy. That's everything from enforcement, micro-mobility, that covers everything from the maintenance and enforcement of our protected bike lanes. We've got curbside infrastructure management. It all falls under that same category as far as when you break out the bicycle lanes, the protected bicycle lanes, the management of those, the introduction of the facility once we start putting those in place. That she has some great ideas, and I think the department has some great plans moving forward, how we're going to be able to really protect the lifelong longevity and safety of our infrastructure.
Thank you, Philip. And then the last, well, Phillips doesn't give himself enough credit because also under maintenance and operation is snow plowing and keeping our roads safe. So he's been quite busy for the past 2 weeks since the day I rolled into town. And I've been extremely impressed because being someone who has not really quite learned how to drive in snow yet, he has made sure the roads are safe, so I am not causing any issues. So thank you for that hard work, and the team, they've been doing a fantastic job. And then the last area that falls in on our organizational structure is administration, which is our finance and grants, our procurement, our human resources, communication, and IT, and we are actually in the process of hiring an assistant director for that position. So moving into 2022, so, we have, in this year's budget, we actually received 42 new positions. We've currently hired 29 of those positions, and so we have 13 positions left. So we've really been focusing on getting those positions hired, really getting the org chart really well structured, and making sure that we're advancing all of these projects forward that we have. We've also been really focusing in on efficiencies within the department. So where there's synergies and opportunities that we can be doing a better job, quicker, faster, and delivering to the community, that's really what we're focusing in. So I'm going to actually, Brad, if you wouldn't mind, I'm going to turn this back over to you and let you kind of speak to some of those efficiencies that we've been working on.
Right. So from an infrastructure aspect, really talking about, traffic calming program is very popular, and we have a lot of applications out there, and we're working through to efficiently deploy those traffic calming projects. Once we get those, we actually are working right now, and we do 50 a year. We actually select 50 a year based on applications. So there's an application process, and actually, end of this month is when this current application period closes. So communities out there, you can get new applications in there. So we do 25 biannually. So twice a year we do 25 selections in there in release. So we are funded for our traffic calming program and working on that. Sidewalk is another area that we are really working to streamline how we deliver those sidewalks. We have what we call rapid repair program that is really helping fulfill some of the gaps that we have in our sidewalk network. We've actually shortened down our delivery to about 100 days in some of those smaller gap-filling sidewalk projects. But we also have longer-standing sidewalk projects out there. We have about 18 that we are going to be looking to go to contract in this year. So we're being really aggressive with our sidewalk program. We have so we are working to streamline that process.
As well as our bikeways.
As well as our bikeways. When I say sidewalk, it also includes our bikeway program too. Really, it fits into that active transportation section that I mentioned earlier.
And just a real quick update on, so we're working really hard. In the past, we've actually have over 400 applications in the traffic calming area. So we're working really hard to try to push those out, understanding that's really about providing a good quality life to our community members. So that is where we're putting a lot of emphasis, and the team's doing a good job. So I know that on Tuesday night, Madam Chair, as the council meeting was going on, it was really exciting for me to hear a lot of our council folks stand up and announce upcoming traffic calming meetings in their community and their neighborhood. So we're really being extremely aggressive, and we have a great team that's really pushing it forward quickly. Yeah, we actually have one going on tonight. That's right. Thank you. And so just a little bit up-to-date information. Through January 18th, we've actually already filled over 16,000 potholes. And then also we've had over 14,000 requests come through the hub. So Hub Nashville is a service request area. It's also, you can go and either make a phone call or you can do it online. It's actually the best way to get information about issues that are in the right-of-way, clean up potholes, signs down, whatever it is, that allows us to quickly react. So we really do encourage the community to use that Hub Nashville to get that information to us, and we're acting it. So not only are you out there taking care of the snow, but Philip's team's actually also out there taking care of the potholes and making sure we're hitting those requests that come through Hub Nashville. And then also some efficiencies is we're working on our utility coordination. This is a conversation that was had where a road was actually paved, and then 2 years later they came in and they dug it up to do a water main valve. So we're really working on better utility coordinations, do it once, do it right, and maximize what you're doing so that you get it all done and you can actually have the extra dollars go toward something else. So we're also working real diligently on putting that program together. And of course, our permitting program is very fluent right now, but we're looking at improving it, our licensing with taxis and limos, as well as just our permitting program for right-of-way. And so our upcoming plans, we kind of already dived into the traffic calming, but we have our capital projects that we're currently working on as well, and Vision Zero. And so I would like to invite the community to join us next week at noon for our Vision Zero Forum. Vision Zero is about getting to zero fatalities and serious injuries that occur on our roadway for all modes. And so it's a very heavy task, but it's really also about changing the culture, and we want everyone to get home safe. One life lost is one life too many. So we're really going to be focusing hard on educating the community, encouraging the community, and engineering, improving our engineering specs on how we design roads, as well as working with our police department on the enforcement side, and then always evaluating what we're doing and how we can do it better so that we can get to zero fatalities that are occurring on the roadways and serious injuries. So we ask the community, please join us at noon next week for our public forum. It is going to be via web, but we would really love to have everybody with us. So this is just some quick pictures of some of the activity that's already in place. It's my time. Move it along quickly. Okay, sorry, I'm out of time, so I'm going to move it along really quick. Excuse me. So for our 21-22 budget, this is how we're broken down. Basically, we have $47 million, and then you can see how it's divided, bulk of it going to operations. And then this is our 21-22 budget for capital spend. So $50 million going towards state of good repair, restoration, resiliency partnership, $25 million, new street lights for the new USD annexation, our traffic management systems and signal upgrades. Super exciting time. That's really is. We're looking to improving how we move the capacity of people on our roads, and again, safely. Our Vision Zero effort, traffic calming and safety, active transportation and bikeways, we got $2 million, and our sidewalk construction. So we have a lot of money to get a lot of work done, and we are working very hard. These two gentlemen did not wait for me, I'm proud to say. They went ahead and started pounding the dirt, and they are doing a great job. And we're looking forward to continue finding those efficiencies and effectiveness and synergies so we can deliver 50% more with 20% less cost and really deliver on our transportation plan. So thank you very much for the time. I appreciate it, Madam Chair, and I'm sorry I went too long.
Oh, no, it's okay. NDOT is the new kid on the block, and so I know it's your first time presenting. Everybody's excited to hear about what you have for us, and so it was okay. I just wanted to make sure we have time for the others. I only had one question.
Yes, ma'am.
By email, and I think you've already alluded to it. The question was, what can neighborhood groups... My mic is on. It's on. Okay, let's try it again. Is that better? No? Is that better? According to this, it's on. But now, no.
You have to bring IT in.
Yeah. What? No, it's not done. Okay, all right. I will move down. I'm not tied to this chair. Because we want you to hear us, so that's more important. It is? It was on. It's okay. All right. Can you all hear me now? Yay, we did it. Thanks, Miss Rosie. So the question that I had, someone sent and said, what can neighborhood groups, non-for-profits, and non-for-profits do to support Vision Zero? And I know you said something about having a meeting next week.
That is a wonderful question. Yes, ma'am. A great start is next week at noon, we're doing a public forum through a WebEx. So you can find all that information on our website. So I would invite everyone to please come and assist. I actually had a great conversation today with a nonprofit organization group called Walk Bike and how we can partner with them. So I am always looking for how we can partner with neighborhoods, advocacy groups, and anybody who's interested interested about getting to zero fatalities on our roadways. So please join us again next Wednesday on the 26th at noon, and it will be through a WebEx forum, and we would love to have anybody else is interested. And just real quick, you know, my email address, I always invite the community, please shoot me an email, is diana.alarcon@nashville.gov, so please feel free to also shoot me an email. Thank you.
Thank you. And if you would address real quickly, you showed the expenses and the things that were going to be done. Are you using any of the federal infrastructure funding for some of these projects? And then on the personnel side, being a new department and having to hire 42 people, how is diversity playing a role in your hiring process?
So, yes, ma'am. We have been working on applying for some of the infrastructure grant dollars to support. We will also be going after more infrastructure dollar grants here in the very near future. So I'm super excited about that. I think there's some great opportunities. And as well, we're still waiting on some of that structure to come down from the federal government to understand what it is and what the process will be, and then exactly what we can do. But we do have some, I want to say, shovel-ready projects that we're ready to, you know, use those infrastructure dollars on. And also in partnership, I don't want to leave out, because we're also partnering up with our partner over on the transit side, WeGo. So we're also working with them on some of those infrastructure opportunities when it comes to talking about overall transportation initiatives. And in diversity, I have to share with you, Chairwoman, I'm going to have to get back with you on that, because I do know I have a wonderful HR manager, and he has applied many diversity practices. So we are trying to encourage folks of minority as well as women and all other groups to participate in and become part of NDOT. I have found that one of the things we really do is have to get out to the community and share all of the new innovative and exciting things that we're doing. And that's something that we will really be doing to attract those type of individuals, because we really want those creative, innovative, out-of-the-box thinkers that are going to help us find those synergies and opportunities to advance forward. So let me get a little bit more direct answer for you on that, but I will tell you my HR manager is superb.
I appreciate that. Just want to make sure it's at the forefront of the process. So,
Yes,
but I
ma'am, of
appreciate it.
course.
Thank you, Ms. Diana. I wrote the names down, Brad and Philip, right? Thank you all for your presentation, and thanks for the great work that you're doing.
Thank you.
You want to check that? And play musical chairs.
Thank you, Chairwoman.
Thank you, ma'am. Great job. 160,000 potholes. That's a lot. So next we're going to have parks. Is this working now? It is. So we're trying out how I look sitting in different places. So I've tried that one, this one. Thank you all. And if you will keep your mask on when you present.
I do. I was going to ask you that. I will do that. Okay. Well, y'all have it's fine. Ready?
Yes, Ms. Odom, Director of Parks.
Thank you very much, Madam Vice Chair. Thank you for inviting us this evening to talk about. Can y'all hear me in the back? Can you hear me now? Now? That's better, so I need to get really close on the microphone. Okay, very good. Again, thank you for inviting us, for giving us this opportunity to talk about Metro Parks and Recreation. I am Monique Horton Odom, the Director of Metro Parks. Joining me this evening at the table to my left are Assistant Director of Greenways and Open Space, Cindy Harrison, Assistant Director for Planning and Facilities Development, Tim Nate, and Assistant Director for Finance and Administration, Shanita White. I have them with me in case we need to drill down some and get you some answers. But at any rate, my mission at Metro Parks is to sustainably and equitably provide everyone in Nashville with an inviting network of parks and greenways that offer health, wellness, and quality of life through recreation, conservation, and community. The park system spans the entire county, and our department serves the community through 9 distinct divisions and interdependent divisions. They are community recreation programs and cultural arts, community affairs, consolidated maintenance, finance and administration, greenways and open spaces, outdoor recreation and environmental education, parks police, planning and facilities development, and revenue-producing facilities. Before I move to walk through our budget, I want to talk a little bit about the benefits of parks in communities. From an economic standpoint, we know that parks improve the quality of life in communities and also contribute to the economic development of an area. We know that parks promote improved physical and mental health by providing more opportunities for physical activity and a great setting to help people recover from mental fatigue, both of which have been essential throughout the pandemic. Then there's the social benefits of parks. Green infrastructure can provide benefits to communities that help increase the bonds between community members, strengthen relationships, and promote healthy lifestyles by creating safer spaces and close-knit and engaged communities. The environmental benefits of parks are critical. They include healthier air, reduced flooding, cleaner water, and cooler air. The economic, health, social, and environmental impact of parks is undeniable, and is why we say that parks are essential to communities. And so, given our limited time tonight, I only have 2 slides, and I know we are, this is a budget information session. So the first slide I want to walk you through, you see up there, it is a depiction of the revenue, our revenue that we receive in the department. Our revenue budget is a little bit less than $14 million, about $13.8 million. And the sources of that revenue, the top 3 revenue sources are golf, the Sportsplex at Centennial Park, and then the Parthenon. We have other areas that draw revenue, our permits, special events, grants, and then Wave Country, and then community center admissions, and some other areas, sports and other areas of the department. All of the revenue that we receive at the department is deposited to the general fund and reallocated to departments. Okay, where's my next one? Rosie. Next. Which one? Is this the one I hit escape on? Duh. Thank you. Thank you. And so now you're seeing a depiction of a breakdown of our fiscal year 22 operating budget. Our operating budget is about $48.6 million. In FY22, we received overall about $3.6 million in improvements for our operating budget, and we are very grateful for that. And what I want to do right now with this slide is just kind of show you how we use our budget and to kind of give an illustration of how lean our budget can be. So again, we have about $48.6 million. And the main areas or categories of our expense budget are salaries, benefits, and then other expenses. Generally, in other expenses, they're pretty much categorized as discretionary spending, but it's not always discretionary. So salaries and benefits, which make up personnel expenses, are about 77% of the budget. That is generally the case in most agencies, that personnel expenses are the largest expense. Even with our budget, our personnel expenses comprising 77% of our budget, we still are a very lean staffed. Again, we did receive position improvements in FY22, and as you have probably heard throughout last year and this year, we are, like many others, experiencing or being impacted by a labor shortage. So it has been challenging to fill positions. We are still trying to work through that. We have folks working on that every day and kind of working outside of the box to try to get creative on how we can attract and retain talent in the department. When we move down further, after we take out our personnel expenses, we have about $11 million left from the overall $48 million. And in that $11 million, we're going to call those other expenses. So that's utilities, that is internal service fees that we pay to central service departments here in Metro, and then transfers. Once you take all of that out, we're left with about $4.6 million. And then that is for everything else across the park system for 12 months. So if you divide that by 12 months, that's a little bit less than $400,000, about $386,000. And I will just emphasize that even though in this illustration it is an equal division of 12 months, we know that the activity in the park system is subject to seasonality. So many of our activities are outdoor, and so our expenses are generally higher when there's warmer weather outdoors. So then back to the $4.6 million spread across 12 months, let's just say that, a little bit less than $400,000. And so that is for everything else that we need to do in the park system. And I have a few examples. This is certainly not an exhaustive list, but a few examples of what would be included in that. So telecommunications or telephones, temporary service, and that is contracts that we might use in the department for maybe janitorial services or other services that we may need to contract for. Janitorial supplies, we do have custodians who service our buildings in Metro Park, so that's all of the supplies that they need. You see it's $413,000. Uniforms and safety shoes, vegetation control, that is treatment for golf courses and grounds across the system, recreation supplies, and then maintenance items. That's everything from paint to building supplies, HVAC, et cetera, et cetera. So I like to show this slide and share it because when you're talking about $48 million, $48.6 million, it sounds like a lot of money, and indeed it is. It is a lot of money. But we also need to keep the perspective and understand that, again, our park system is vast and aging, spans the entire community, the entire county, and demand for our park system is very high. We kind of joke in the department that people love parks to death. And you have to really appreciate that people really, really enjoy parks and parks facilities. We absolutely do. I am very pleased to serve in a department where we have so many people who have been in the department for a long time and or are very passionate and dedicated to the work that they do. Very committed to serving the city of Nashville. So that is one of the things that I love about the Parks Department. We have, I'll wrap up in just a moment, Madam Vice Chair, and take questions. But I did just want to touch on our FTE and head count. We have about 800, a little over 800 regular full-time and part-time positions. That doesn't include seasonals or those positions that that we call pooled or are used as needed. About 567 of those 808 are filled. And go back to the 808, that's a head FTE count, I'm sorry, of 566. We have about 241 vacant positions. Again, that includes seasonal positions, and we will begin to hire for seasonal positions in the next couple of months, so probably about 8 weeks for all of the, again, seasonal activities, outdoor activities that we will start when the weather warms. With that, just to touch on looking forward to FY23. We are still in the process of developing our budget requests. As you may or may not know, the budget process has not officially started yet, but we think about it all year. So it is safe to say that we will make requests that correspond to completing full-year funding for some of the positions that we received in this year's budget. There were some that we received in July that were fully funded, and then there were some that have been funded for half years. So they started in January and will be funded through June. We will request the other half of that funding, and then we'll also, at this point, request funding for any capital spending funding that has operating budget impacts, that will have impacts in FY23. So projects going forward. So I'll give you an example. We don't have online to have a completion of a community center at this point. While there is one in the pipeline and going to be worked on, it won't be finished in FY23. But just say if it was being finished in FY23, we need to make sure that we have a staff and request funding for staffing and operations for when that center opens. So we will move forward in that vein with any projects that we need to that will be impacted and will impact the department in FY23. We'll also look to identify efficiencies, that is, areas where dollars can be redirected, reallocated, or eliminated. Sometimes there are processes that are being duplicated or programs that the community no longer uses, or there's very little attendance, to redirect those dollars and make more efficient use of that funding. So with that, Madam Vice Chair, I will take any questions that you have.
Thank you. I do want to say that one of the lessons that this is teaching me is that you should not cram 4 departments into 1 hour. I think that is not feasible, is not realistic. So I hope to those of you that are watching, I hope you will indulge us. We probably will go over an hour because we still need to look at the hospital and housing, and all of these are important. I will say that to anyone that may have questions about NDOT, I know that we had to cut the time short for them. Please know that you can, and Parks, and any of the departments that are presenting, you have the opportunity to still send in questions. That we can forward to the department for you to see. Also, let me clarify that this is just to give you an overview of what this department have this current season. When the budget process happens, we will have other opportunity for you to ask questions, and when the actual numbers for FY23 comes out, you will also have so many opportunities to ask. So please don't feel as if you're being rushed. Consider this like a primer, an overview. You can go back and watch it, look at it, and like I said, please know that we will always take your questions anytime that you send them. I think that was important. Now, the first question that I have for you, Ms. Odom, from our audience, thank you so much. Do you recruit seniors? Because we have so many seniors that are in excellent condition.
Thank you for asking that question. We don't discriminate in recruiting, but then too, in our efforts of diversity, equity, and inclusion, which is a priority for the department, seniors are a very important group, and I think have a lot of value to add. So absolutely, if you are interested, by all means, please reach out to me, monique.odom@nashville.gov, and let us know. You know, again, seniors are a very valuable part of our city and a demographic largely that are underserved. We have senior programming specific for seniors in metro parks at a few of our regional centers, and then a standalone center for seniors at Elizabeth Community Center on Monroe Street. But we would very much welcome you to be a part of our team. So absolutely.
All right, one last question, and if you can answer very quickly. One of the things that you mentioned is the problem with finding staff. I know one of the things that we did during the last budget season was increase your FTE or give you additional staffing. So if you're having problem recruiting, has that impacted your services in any way?
We have adjusted. I will say so the impact on the services is kind of twofold. As I mentioned before, it has been quite challenging to attract folks to fill vacancies that we have. That was last year, and it's kind of been a trend for the past 5 or 6 years. You know, for certain positions, it is challenging to attract, recruit, attract, and retain, and we have worked and continue to work with Metro HR in that area. But then too, you mentioned has that impacted our services? I will say yes, and then too, with COVID being a very real phenomenon in our society, that has impacted our teammates as well, our services, our ability to provide services. With an already lean staff, you can imagine if someone has an exposure or tests positive for COVID, we have to do some very quick shifting, pivoting, and adjusting. So, and that may mean impacting operating hours at some of our park facilities. So I'll say yes, yes, yes.
Thank you. Thank you, Director Odom and the staff for the work that you're doing, and thanks for being with us.
Thank you
At
so
this
much.
point, we'll have Metro General Hospital CEO, Dr. Webb.
Thank you.
Yes, sir. Oh, thank you for being here. She's chair, yes, she's chair of budget and vice chair. Yes, yes. So she's out today. How are you, sir?
For some reason, I'm losing the mouse.
You got some new chairs?
She's doing all right.
Oh.
She's just not, she's just unable to do this session.
Live,
But she's
I think so. They've been going back and forth. I don't know why it's doing this.
The computer uses today, chose today to be out. All right, we're good.
You're on this.
Oh.
There you go.
Does that get bigger, or is that as big as it gets
It's
on
just-
this screen?
Yeah,
Would
is
that
it too
enlarge
big?
it?
Not big
No,
enough for you?
Would that enlarge it up there?
I don't think so. Can't see it right here.
Ooh,
It's too.
I don't want to see the notes. Can we click on that? If you
Yeah,
click on
just-
that, does it get bigger?
And my apologies if you see me looking at my phone. I'm checking to see if we have questions.
And
The people are texting and telling me stuff, so that's what that. So,
Oh, yeah, we can go to the slide.
yeah, just use the
Yeah, go
slides.
to the first slide.
Use this
there
one.
and see. Yeah, that one.
Yeah.
I just need my glasses.
Okay.
That'll be interesting. No. Okay. You ready?
yes, sir. You recognize?
Can you hear me good?
Yes.
Okay. Well, first of all, I want to say thank you to Madam Co-Chair, Council Lady Zolfat, and express my appreciation to the Chair of the Budget Committee, Council Lady Berkeley Allen, for inviting us, Nashville General Hospital, to speak with you today and to share some insight into our budget, our budgeting process, and how we go about consuming the resources of the taxpayer dollars in generating healthcare delivery. I have with me today my Chief Financial Officer, Mr. Bruce Narramore, and I will be sharing with you the information that we've prepared to, again, give you more insight into Nashville General Hospital and the things that we do on a daily basis. In 1890, the city, by way of charter, created Nashville General Hospital for the purpose of serving the healthcare needs of the aged, the young, and the indigent population. 132 years later, Nashville General Hospital is still going strong, and it is, as of today, Middle Tennessee's only public hospital. We're a licensed 150-bed hospital, tertiary level. Tertiary is an acuity level below the quaternary hospital, which addresses transplants and major trauma at a higher level of acuity, and the tertiary hospital is above the acuity level of the ambulatory facility. So essentially, it's commonly referred to and looked at as a community hospital. So we oftentimes like to refer to Nashville General Hospital as the original community hospital of Nashville. We utilize evidence-based models to improve the health outcomes of our patient population. I will share a little more with you in a second about what we mean by evidence-based models. And we are also the index teaching hospital for Meharry Medical College. Our mission is to improve the health and wellness of Nashville by providing equitable access to coordinated and patient-centered care. Now, because we are a index teaching hospital for a medical college, we also support tomorrow's caregivers in their knowledge and learning, and we also contribute to the local resource of research through our translating science into clinical practice activities. So Nashville General Hospital, as I stated, is an evidence-based, uses evidence-based models to deliver health care. We're an integrated healthcare delivery system. And by evidence-based, we're simply referring to utilizing models that have proven to be successful with delivering desired outcomes, health outcomes for our patient population. And by integrated, we simply mean that we're more than just a hospital with 150 beds. We also have more than 25 clinics, about 25 clinics that we operate, most of which are on the campus of Nashville General Hospital. And we have the 1919 Charlotte Clinic, which is an full ambulatory clinic on Charlotte in Midtown. So as we look at the integration of our system, we focus on the transition of care being seamless and the individuals moving from ambulatory to inpatient or from inpatient to ambulatory without fragmentation or dropping of any care. So that's what we mean when we talk about an integrated healthcare delivery system, and that being evidence-based. Now, as we look at the strategic initiatives at Nashville General, our strategic goal is a triple aim, and that is a model that was created by the Institute of Health Improvement to address the overall care delivery for populations of patients. And it has three dimensions. The first being patient experience. What type of experience does the patient have while they're in your care, and are you improving on that? The second dimension is population health outcomes. Did the patient improve? Did their health improve as a result of their receiving care from your organization? And the third dimension is the cost per capita element, and that is looking at providing care as efficient as possible and, where possible, reducing the cost of health care. As you know, health care now, today, is closing in on 20% of the gross domestic product. It's at about 18.5 of the gross domestic product, which means that you as a consumer, for every dollar you spend, you're spending close to 20 cents of that on health care or healthcare services. The next item is the clinical strategy. We utilize the chronic care model, which is a model that's used for addressing chronic health care issues, both preventive as well as caring for chronically ill, such as hypertension, congestive heart failure, diabetes. And those conditions are basically the ones that will generate the lion's share of cost in healthcare expenses. So we utilize the chronic care model to drive towards improved outcomes from a clinical standpoint. And our execution strategy is the patient-centered medical home and patient-centered specialty practice. We refer to the patient-centered medical home. Those are the primary care providers. And so that framework helps us to guide our patients under the care of primary care physicians to an improved outcome. And then there's the PCSP, the patient-centered specialty practice. Those are the specialty practices that collaborate with the primary care practices to create that seamless approach that we talked about earlier in the integrated healthcare delivery. So as we take a closer look at the actual budget for Nashville General Hospital, you see here two columns, well, three columns, the categories, and then you see the budget for fiscal year 2022 and an actual projected budget fiscal year 2022. So the difference between these two columns is the budgeted column is one that was created initially as a budget, and that's usually done about a quarter, 3 months or so prior to actually going into the full budget year. So it is based on historical and other elements that help us to determine what we believe our budget in expenses and revenues and others will amount to. The projected, actual and projected, is done after you've gotten into the year at the beginning, and there's a point in time that you can look at projecting forward based on your budget and actual and historical. You get a better feel for how you're going to do during that year. So that's the difference between those two columns. But as we look at the hospital-generated revenue, patient revenue, at 49.2 million, and then across at the actual projected side at 51, we see that we're actually projecting to do slightly better on the hospital-generated patient revenue. And as we move down to the other funding, there's actually a line there, the HRSA, HRSA line. In the projected column, we anticipated in the budget period that there would be no funds for that resource of for COVID uninsured, but actually we did realize that they are still issuing some HRSA funds, so we anticipate around $2 million during the course of the year for 2022. The other government funding total here, we look at $17 million and $12 million on the projected side. The difference is that starting with the first line item here, public hospital supplemental pool, that is a fund based on 3 major public hospitals throughout the state of Tennessee, and we're one of them that receives funding, but it is a matching fund. And you'll see that in just a second. This 11.5 million is the fund amount that was budgeted for the year. You see a $7 million actual that we're looking at projected. So the disproportionate share, the second item, state disproportionate share, that's a state and federal resource that is utilized to help to offset hospital costs that care for a larger portion or a disproportionate share of Medicaid or indigent patients. And then the graduate medical education, GME, is an amount that is a federal fund or support that helps to offset the cost of training medical students, because there tends to be a higher cost when you're training students than what you would normally have in a tertiary hospital, as you're utilizing more supplies and time and support and equipment than you would normally utilize. So that's the government's way of helping to offset some of the cost of training additional medical students for the market. And then the final Medicare disproportionate is another state and federal offset to assisting with that disproportionate amount of patient volume that you care for that is Medicaid or indigent. All in all, we see a subtotal here of $66 million that comes as a result of the hospital itself existing, both with the collections or the revenues generated by the hospital and the supplemental funds coming from federal and state resources. And then we move down to the Metro Subsidy investment, which is the $49.6 million, and that is what we have were given as an investment into the care of the patients at the hospital here this year for 2022. And we look across and we see that 114.9 versus the 115, which comes out pretty close to being the same, but the difference is, as you can see in the public hospital supplemental. As we move to a closer look at what consumes the investment and the subsidy that is provided by the taxpayers of Metro Nashville, we see the $49.56 million that was allocated for the subsidy in 2022, and the deductions from that prior to those dollars being used for operating expenses at Nashville General. You see the 11.8, and the makeup of that is one of the before we can actually utilize those funds, we do allocate $4 million to the lease cost of our building, the parking garage at $1 million for spaces in that parking garage, and then the intergovernmental transfer, which is that amount that I referred to earlier that we get as a state supplemental fund. It's a matching allocation, so we deduct $4.4 million towards that, and then we receive $7 million from that 11. That's where that comes from in that first column on that second page. So, and then we have the legacy pension where we cover the cost of the pension plans, pension plans for Bordeaux and Knowles, and that's at 2.4, and that puts us at $37 million. And through the years, we received security services from the sheriff's department, and that over the last year changed, and so it became an unbudgeted item for us, but it does come out of our expenses, so that's at a $950,000 cost for us, and it puts us at $36.7 million that we apply to our actual operating expenses. So as we look at the budget, the subsidy itself is a 42.8% of the hospital's total budget investment. The uncompensated care that we provide as a result of that is $60 million. So with the $49 million that accounts for 42.8% of the budget, we're able to generate $60 million in uncompensated care to patients in the Nashville community. The patient revenues over the last year for Nashville General Hospital was over $52 million, which did not include the CARES Act funds, which is $13 million more than the previous fiscal year. So as you look at this and you think about what type of investment is the city making in the care of its indigent population and supporting Nashville General Hospital, you see here quantitatively the average of $60 million in care. So Nashville General Hospital has shown an increase in revenues over the past years, and since fiscal year 2018, and decreasing reliance on the Metro subsidy. If you look at 2018, you see 52 million, dropped to 46 million in 19, and 2020 to 43, and again 43 in 2021. We did increase to 49, but that was in this current year. That was a result of projecting COVID costs and expenses due to COVID-19. We have seen an exponential increase in pharmaceutical costs. Labor cost has grown exponentially as well, having to utilize a number of contract labor, particularly in the nursing areas, which is across the country and not just here in Nashville, and other costs with supply-related items as well that have driven up the cost. And so we saw a projected, or at least a budgeted amount of increase for 2022 fiscal year. That's likely to continue into the next fiscal year, just as a caution, with some increased costs. So the healthcare services that we've been able to amass over the past several years, in 2018, there was an announcement made regarding the hospital's status. And as a result of that, a number of physicians, particularly from Meharry, left their employ with Meharry, and we were left without some services that needed to be provided. So we had to engage in hiring some providers. And if you look here, you see under the first column, in cardiology, we hired 3 providers. in 2018. Orthopedics, we hired 4, and that was over a period of 2019 and 2020. In urology, we hired 3 providers during 18 and 19. Okay, and I'm giving the, got to speed up the process here. So you can see that we did add a number of providers to the total of 16.6, and that annual cost was 5.7 million. But if you look at the growth that I just mentioned in the net revenues, you see that that was around 13 million. So if we look at the differential there, we see that there was a benefit to hiring those providers. This is a look at the overall services that are provided at Nashville General Hospital. Let you get a quick glance at that. And here are some expanded services that we'll be looking at for 2022. Gastroenterology, ear, nose, and throat, or otolaryngology, and telepsychiatry to cover our behavioral health population, which we're much in need of expanding services there. And the Nashville Healthcare Center at Bordeaux, which is going to be made up of a primary care and urgent care clinic, outpatient diagnostic imaging, as well as weekend and weekday convenient hours. And that clinic is scheduled to open in the fall of 2022. Just a few select accomplishments. We improved in our patient population. The patients that are diabetic with their blood sugar A1C in control of that blood sugar went from 39% to 60% controlling their blood sugar, which means keeping that blood sugar down at a level that they're healthy. 43,000 patients were seen in our ambulatory division, which is a 24% increase over the prior year. Community-wide COVID events and sponsorships that we had were numerous and made a contribution to the community. We earned the Tennessee Center for Performance Excellence Level 3 Achievement Award, which is a Malcolm Baldrige designated award at Level 3, which is Performance Excellence. And there are 2 more levels, number 3 being one of the most difficult to attain. So we're continuing on our Malcolm Baldrige journey in performance excellence. So I will conclude with that. Just a look here at the 2 sites, and for Nashville General Hospital, and the 3rd pending opening in the fall of 2022. And I will conclude with that, Madam Chair.
Thank you very much. We appreciate that, and thanks everyone for sticking with us. The only question I have for you, I think one of the questions that I had is already answered. Metro does not fully support Metro General. It's not 100%. So you have other sources of revenue. So Metro support is 42%.
Right.
What percentage of your total revenue is Metro support?
42.
About 42.
40 to 42%.
Okay, all right, good. And then in the projection that you shared, which is a combination of the actual and projected, what percentage of that, up to what month was actual that was included in that number?
Through November actual, projected
Through
December
June.
through June.
All right.
Yes.
Thank you so much. Appreciate it, and thanks for all the work that you're doing. Thanks everyone that is listening. Thanks for sticking with us. We're way over, but our healthcare, housing, all of these are important issues, and we want to make sure that you have the opportunity to listen. Again, if you have any question for Dr. Webb and Metro General, please do send it, and we'll be glad to send it forward to them. So thank you so much for being here.
Thank you again, Madam Chair.
Thank you. Yes, sir. Thank you for your patience. She's okay. She's fine. She's fine. She's not ill as far as I know. She told me on Tuesday she was just not going to be able to make it.
Yeah, yeah.
Yeah.
I know she's had some problems with her wrist, so I was wondering if it was that.
Hello. How are you?
I am,
Welcome aboard.
thank you.
All right,
Remember,
next
you
we're
know
going.
George Rooker?
Yes, yes, yes. How are you doing? All right, next we'll have housing, and we have with us our new director of housing, Miss Angela.
Thank you, Vice Chair. I hope everyone can hear me. I'll try to speak loud. Joining me are Hannah Davis, who has been leading the housing programs from the mayor's office, and she's moved to our team. Also, we have George Rooker from our planning department, and we'll be talking about our new structure with our housing team. So we are a team as of January 3rd. We are excited to have both Hannah and Ashley Brown from the mayor's office move to the new housing team, as well as the opportunity to hire a new research analyst. And then we also are working with a Fuse Fellow, short-term for the year. We are now part of the planning department, and we're excited to be incorporating housing strategy into planning work. That's one of the great benefits. The other is really to being able to benefit from planning's organizational structure and their administrative infrastructure. So that's really helping us on the administrative side as we get our team up and running. Since January 3rd, the short time that our team has been together, we have created a very bold vision for our work, and that is that every Nashvilleian has housing security. And what that means to us that we're starting to define is housing is affordable, it is of good condition, and it is safe. And that makes it a person-centric approach to addressing housing needs in Davidson County. I'm going to flip it to Hannah, who has worked on a number of these new initiatives to talk about what has been accomplished and funded in fiscal year 2022 and what we're going to be launching later this spring.
Great. Thank you, Angie. I am really grateful to have Angie on board to help us kind of evolve, and really grateful to planning for helping us incubate all this work. So thankfully, Barnes Fund continues to go strong. So we just wrapped up the fall round of awards, and that was, as a reminder, a combination of $12.5 million from the operating budget, and then we also had received a $2.5 million grant. So in all, we were able to piece together about $16 million to create and preserve 867 units. So a really exciting round, and those contracts will be coming to the council in February for their final execution. And then new housing staff, obviously. We have some of the product of that here with our new director. That was also part of FY22 operational budget. And as Angie said, that also included a research analyst, and that position will be posted this year, coming next month. There's a housing incentive pilot program that some folks may know about. It's funded at $200,000 in the current budget. And that's a program that's focused on creating units in mixed income environments. And that program is currently underway. And then additionally funded in the operating budget was funding $500,000 for a unified housing plan. And so that is going to be focused on long-term alignment of systems, partners, and resources to make sure that we're efficiently and effectively delivering housing security across all of state, federal, local, philanthropic funding streams that we're all working in coordination. And so that will kick off in spring 2022. And then you may recall last month in these chambers, we were here for approval for some ARP funds directed towards our city's housing needs. So there was approval of $20 million to go to the Barnes Fund, and so that expected outcome from that will be about 1,000 units. And the Housing Trust Fund Commission is actually going to be overlooking those criteria for those awards next week, and we plan to launch the RFP for those awards, or the competitive round in the spring. The Catalyst Fund is going to be a new tool that's $20 million, and that is really going to be a crucial tool to help us preserve affordable housing. And we're working to launch that in late spring 22. And then a centralized resident portal, which we've also talked about a significant amount in these chambers. Funding for that from ARP is at the $200,000 level, and it's going to be focused on connecting residents to housing opportunities and really decreasing the time that folks have to spend trying to find an affordable unit and achieve housing security in the county. That will launch in late 22 as well. And then one other line item that's not an expenditure, but was projected decreased revenue of $3 million and is a mixed income pilot. And the expected outcome there is really to incentivize mixed income housing. At the local level, we're able to have a little bit more flexibility. And so this will allow us to partner with more developers and increase our capacity across the county. We're working to launch that in late spring 22. Angie will be able to tell us where we are headed going forward.
Thank you, Hannah. And Madam Vice Chair, as you can imagine, I get lots of questions about what is our housing team going to do? And so I wanted to share some of our focus areas. The first is around making sure we have current, reliable data and that is communicated consistently. A lot of the data we rely on is census data, and that's often dated. And one of our big tools, the American Community Survey, which is an offshoot of the census data, is actually not going to be produced this year. So we need to make sure that we're getting our hands on good market data that's telling us the real need in this dynamic housing market. But more importantly, it's understanding what's happening at the community and at that resident level. And that's from the council members, you know what's happening in your district, so I look forward to speaking with you and understanding your housing needs, and then hearing directly from residents about what their experiences are. That's how we understand what the housing security challenges that they face, and then what partners and resources that we can help connect to as we build the unified housing plan. One of my 60-day priorities is really understanding the resources and tools that are currently at our disposal to address housing needs, specifically around creating or preserving permanent housing solutions, and then aligning those tools to make the biggest impact. We really want to be showing progress and moving the needle the best way we can with the right tools and having right-sized solutions. Creating streamlined pathways for residents to access housing resources is another focus area, and this is reflected in one of the tools Hannah mentioned that was funded for the resident portal. That's going to be our starter for streamlining that pathway, as well as streamlining pathways for the developers and our housing providers to utilize the tools that exist. We want to make sure that we're showcasing what's coming online, what our progress is, what our need is, and being out in the community and being transparent through robust community engagement, and then having public-facing dashboards that is showing as much real-time data as we can show to show where housing exists. And that's where that inventory will start feeding into this dashboard. And then another big focus area is creating that efficient and effective and a sustainable structure to address housing needs in Davidson County. That'll be built in through the Unified Housing Plan. All throughout these processes, we'll be working to implement the high priority recommendations of the Affordable Housing Task Force that was convened around this time last year. And we've seen that a lot of those recommendations have already been funded through the FY22 budget, and we're looking forward to taking on the rest of those high priority recommendations this year. And so it's a short but sweet presentation, but I'm sure there's lots of questions either now or forthcoming as we evolve through our first month as a new team and moving forward.
All right. Well, thank you. Thank you for making it short, and because we also out of time. Ms. Hannah, did you say 20 million for bonds fund? Was it not 40 million?
It was 40.2 million in total, 20 going to the Barnes Fund and 20 going to the Catalyst Fund.
I wanted to clarify that so that people are not thinking, oh, why did she say 20?
Yes, thank you.
I thought that was very important.
Thank you.
One of the things that we saw in the chamber the last time was that we had a situation where cost is increasing and our developers are not able to produce as much as we want them to. Is there something that is being done to address this so that we can continue to have the numbers that we need?
So what we have to keep an eye on are the costs that are escalating. It costs the same pretty much to build affordable housing as it does any other type of housing. And that's what's putting pressure on the affordable housing developers at keeping their prices, if they're building home ownership, within the range that the income targets for Barnes or other funding sources. So that's where we need to be finding the additional resources that can help them make them whole so that they can keep those prices and those rents at that income targeted level.
Thank you. And I have to ask you this because I get it all the time. Ms. Hannah, can you tell us how many units have we produced with the Bonds Fund to date?
Yes. If we count the 867 that were approved by the commission, we are just over 3,000 units.
All right. So thank you also very much. Thanks for the presentation. Again, this is to give you an idea of what the department are doing so that when it comes to budget season, you're already familiar with some of the numbers. And then come budget season, we will be asking some more questions. If you have any question on affordable housing or any of the folks that presented today, please send us an email. We'll get your question asked. Again, sorry we delayed you till 7:30, but these are important topics. We want to keep our community engaged, educated. We want you to know about what's going on. That's how we build trust. Next week, we will be joined by Finance Department, and we'll be looking at the debt service and the CIB. If you have any questions, send it to buckley.allen@nashville.gov. Thanks, everyone, for joining us. Thank you, guys. We appreciate it. You all have a nice evening.
Thank you.
We are adjourned.
Thanks for having us, Vice Chair.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.